Patients who were being brought in from a great distance away weren't getting the care they needed in the time to be effective, so it was causing patients to die who probably would have lived if they could have got to the hospital faster. There was something that was used in the Vietnam and Korean wars to transfer soldiers who were injured quickly back to the hospital, and that idea started in the United States. By the mid-'80s, it was pretty well known that this is something that could be applied all over.
In 1986, Theda Clark decided to follow. We were commissioned to flight on June 2nd, 1986 as the third program in the state of Wisconsin. On June 6, 1986, we would have our first flight. It's hard to believe it's been 35 years, but I have been here since the inaugural flight.
It takes a very strong, confident person to do this job. You know, you're gonna have bad days, and you have three choices. You can either let it define you, you can let it destroy you, or you can let it strengthen you.
I always say it's not the blue suit, it's what's in the blue suit.
There's not much that our team cannot do that you can't get in an emergency department, and the amount of training we do, that sets us apart. We want to be the cream of the crop, and we have to be. People's lives are on the line.
We were on a Harley. We got hit head-on by a car. I ended up hitting the windshield of the car, and then I flew over the car about 40 feet in the road, tore my aorta, busted all my ribs, every rib. My collarbone, my shoulder, and my scapula. My left hand. They saved my left hand. I'm not supposed to have it. Broke my pelvis in 6 spots, and I broke my left foot.
Both hands, both legs, tore my pelvis away from my spine, broke that in half, and they made a call on who's had to go first, and they seen too many bones hanging off not to take me.
And what they didn't know, it was I was bleeding out. If they wouldn't have put me in that helicopter, I would not be here.
The ability to be there at somebody's worst time and make an impact. When you get to meet a patient after the fact or talk to a family after you've flown one of their family members, and just the gratitude and the emotion that they express that's all the thanks you ever need.
It's important to emphasize how the relationships with fire, EMS, and other healthcare providers impact the patient's care.
First responders really make the biggest difference. So they're the ones that initially assess the patients, determine if they need a helicopter or not.
Working with the other first responders and different hospitals out there and just partnering so we can provide everybody the highest level of care. And I could pick out specific patients that I know benefited from the speedy transport and the care that was given to them.
When people see ThedaStar flying, they should know that someone's about to receive the best care possible.
Somebody's getting an opportunity that they wouldn't have had if this service wasn't here.
When you see ThedaStar in the air, hope is on the way for somebody.
I look at all the care and everything they did for us. You're in good hands, people. If you got ThedaStar picking you up, there's nobody better.
We stand on the shoulders of so many people, past and present.
The vision was started by community leaders and some physicians who raised the funds and developed a plan to get this program started.
We work with shining stars and unspoken heroes that honor the call to serve people every day, and I feel like we're all part of something that's a lot greater than ourselves.